So the first question is to Dr. Jason Sandberg. And the question is why does the treatment for prostate cancer in general place male erectile function at risk?
Sure. So the short answer to that question is the sort of machinery, the plumbing, if you will, that's responsible for erectile function is near the prostate. And so, namely, we're talking about nerves and blood vessels that are responsible for erection, run right along the lateral and kind of posterior backside surface of the prostate. And oftentimes, intentionally or otherwise, oftentimes intentionally due to the desire for excellent cancer control. When a prostate is removed, for example, those blood vessels and nerves can be damaged. The same thing can be true of radiation therapy, of cryotherapy or freezing, or of heat therapy that some men undergo for prostate cancer. And so, oftentimes the side effect of prostate cancer treatment in order to cure the disease or get control of the disease optimally is going to result in erectile function dysfunction.
So there is data that shows that men, as they get older, will suffer from erectile dysfunction in and of itself, not even as part of prostate cancer survivorship. What is the general incidence of erectile dysfunction as men age? And what are some of the comorbidities? When we see a man who comes in the office, what are some of the risk factors for making their erectile dysfunction worse and may even play a causal role?
Sure. So, I mean, the incidence of erectile dysfunction is large, and I tell all the men that I see exactly that, because as you mentioned, there is an evolving conversation and willingness to talk about it, but there are still plenty of men who are not discussing this with their friends, their family, and even their wives and girlfriends. And so, the first thing I do is I tell them, hey, this is a very common condition. Studies suggest that 25% of all men at some point will have erectile dysfunction in their life. And when you take men above the age of 40, that number is above 50%. And when you take the men who have had prostate cancer treatment, it's even higher. And so when you take all of that together, a very, very common condition. Then when we're evaluating men for erectile dysfunction, with or without a history of prostate cancer or treatment for prostate cancer, we do have to look at their other medical history. So things like diabetes, heart disease, high blood pressure and blood pressure medications, other medications that men might be taking for various reasons could be causing erectile dysfunction. Other types of non-urologic surgeries or conditions that patients might have been treated for example, colon and rectal cancer may result in erectile dysfunction. And so, there's a whole wide variety of potential causes and contributors, and oftentimes treatment will be or the treatment pathway ultimately will be decided based on in some part what those things might be contributing.